5.
Yes.
Quadruple November.
Yes, I believe that, to me, this represents probably a more realistic depiction of the situation on the morning in question. Although, again, it assumes that Mr. Jackson would have taken the pills all at the same time, and I think it's quite conceivable there could have been some time lag between, he may have taken pills in smaller amounts around the same time.
So it's not necessarily required that you take all 8 pills at once. You could have taken 4 pills and then 4 pills, or if they're whatever, you could have taken them at 6, taken some at 8, or whatever time.
Yeah, I mean, you could, again, we could play with these curves in the same way and create a number of different simulations, all designed to achieve the same concentration at the time of autopsy.
May I just ask for clarification?
Please. Do counsel want to confer?
Doesn't,
Can we approach, Judge?
I'll just,
Yeah, rather than do it in open court. May we?
I think we can just clarify right here.
All right, on the side, please. Counsel are conferring. Clarified, Mr. Walgren?
I think this is fine.
Mr. Walgren?
This scenario, we don't know at what times how many pills were taken, do we?
No.
This diagram here just assumes all 8 taken at one time around 7 o'clock.
Correct.
But it could be some taken at 6 and some taken at 8.
Absolutely.
And without knowing exactly what happened that night, this is just a general average of indicating what would happen if some combination of these pills were taken at times close in proximity.
Yeah, in fact,
It's testimony that indicates 16 milligrams at 7 o'clock.
Sustained as to the form of the question, the last answer is stricken. You may continue, Mr. Flanagan.
What does this diagram demonstrate?
well, as I stated earlier, this diagram, just for purpose of illustration, just shows the effect of giving 8 lorazepam tablets orally. But as I stated earlier, I said you could easily generate a similar curve and achieve almost the identical concentration by giving, say, 2 milligrams, a number of pills here at 4 a.m., pills at 6 a.m., or at 8 a.m. So there's a number of combinations, and it would be my guess, if you will, that rather than taking 8 pills at the same time, that Mr. Jackson may well have taken 3 or 4 pills at a couple of different times. But I'm just speculating. We're using these simulations to see how it's possible with oral self-administration of lorazepam to achieve the concentration that was measured at autopsy.
And the speculation, the scenario that you've come up with is the more reasonable scenario than, say, Dr. Schaefer's speculation regarding the continuous bolus dosing of 4 milligrams.
Well, he didn't have continuous bolus dosing. He had frequent bolus dosing. I think it was 30-minute intervals. And yes, I do feel that the theory that we've proposed is just a lot more rational and would represent a more appropriate clinical situation.
And when you come up with the idea that you think there must have been oral lorazepam taken, are you taking into consideration the small amount of lorazepam that remains in the stomach?
No, as I hopefully clarified earlier for the jury, the drug dissolves fairly quickly, 15 minutes. It's absorption half-time. Again, I'm sorry to use these confusing terms, but the time, it's an index of how long it takes to achieve a peak level, has been reported to be 22 to 40 minutes. And most importantly is that lorazepam has very little first-pass metabolism. You heard earlier Dr. Schaefer talk about propofol. and why he didn't expect propofol to be absorbed from the stomach, because it's extensively metabolized when it first is absorbed and passes into the liver, what we affectionately refer to as first pass effect. Lorazepam, in contrast, has a very high bioavailability. Approximately 93% of a given dose orally will appear in the blood. So it's very different than the situation with propofol.
And in forming your opinion, do you rely upon the article or the paper written by David Greenblatt?
Actually, there are two papers by Greenblatt, yes, but for the modeling, I think the one that you were provided describes the modeling. There's also an additional paper that talks about the lag time, or the time to dissolve the tablets and the time to achieve levels in the blood.
And, Your Honor, I'd like to mark this one as quadruple O.
Quadruple Oscar.
The article by Greenblatt, it takes into consideration absorption, reaching peak concentrations, and elimination.
I believe so, yes.
And based upon that article, would you expect there to be, would it be inconsistent with your opinion that there's 1/300th of a pill that might still be left in the stomach?
I'm sorry, I'm not understanding exactly your question. Could you restate, please?
I think there's evidence that, as it relates to free propofol, there may have been 1/300th of a pill still in the stomach at 12 o'clock time of autopsy.
The equivalent of 1/333rd of a tablet.
I think you should rephrase it with that
Okay.
in mind.
The equivalent-
Is there an objection?
Objection.
Okay.
I'll
Sustain.
rephrase it.
Rephrase it.
Your description here, would it be inconsistent with 1/300 or 1/330th of a 2 milligram dose of lorazepam in the stomach?
Yes, I think the important point is you would not expect to see any free lorazepam in the stomach, because it is completely absorbed, unless you would not expect to see any free lorazepam in the stomach if it was only given intravenously. That's my point, because there is no what they call post-mortem redistribution, which means a drug going from the bloodstream into the stomach. So the fact that there is even a tiny amount of free lorazepam is consistent with the theory that he took lorazepam orally.
I'm going on to a different area right now. Would this be a good time to take the morning break?
I think so. All right with the people?
Yes, sir.
Ladies and gentlemen, let's take the mid-morning break. Of course, remember all the admonishments. We'll be in recess until approximately 25 minutes after the hour, 15 or 16 minutes, give or take. Thank you.